watching Let's Chat.
Welcome back to Let's Chat. Now, as temperatures are decreasing across the area, our numbers of COVID-19 cases are unfortunately increasing. This morning, we have some information from the Hamilton County Health Department on how to slow or maybe stop the spread of COVID-19 in our homes. Here with that information is Miss Connie Beaker. Good morning, Connie. How are you?
Good morning. I'm great. How are you?
Doing great. Of course, we're seeing an uptick in COVID-19 cases across our region. We know that the cold weather affects this and is part of that, but tell us a little bit more, the most recent information on how the virus does spread.
Well, we believe it certainly spreads most often person to person, and usually through being in close proximity to somebody who has the virus, may not even know they have the virus. We have a lot of cases that have no symptoms at all, so you can't really tell when you're near somebody who might be positive.
And you mentioned that close-to-close contact. Of course, when someone is at home and we have a positive case with a family member, we live in the same household. You have some tips for us on how to maybe slow the spread, if not keep the rest of our family safe when we're inside the same household. Share those tips with us, if you will, please.
Well, it's a very tricky situation when somebody is positive in your household and everybody is not positive. So every minute that the rest of the family is around somebody who is tested positive, they're being exposed to the infection. So it's best if there is one person in the household that's positive that they get their own room, and if it's possible to give them their own bathroom and get them to stay separate from everybody else is to everyone's benefit. I know that's difficult or impossible in some situations, and everybody's family and household situation is different, but you particularly want to try to protect the elderly and people with chronic health problems because they are at higher risk for serious complications of the infection. So people with somebody in the house who tests positive, they want to clean the house well, clean the surfaces well, as much as possible, open up the windows, air the house out, and try to keep people separate. The problem is that 2 days, up to 2 days before somebody tests positive or has symptoms, shows symptoms, they're contagious, they're infectious to other people. And so it's hard to say, unless somebody else in the house was totally out of town prior to that, that they haven't been exposed. So it's kind of hard to send kids off to grandma's when they've already been around the person that has the positive test.
Right, of course. So, of course, everyone stay home until we know what the situation is. You're also suggesting to wear our masks inside the home and, of course, prevent pets and children from going between the sick person's room and the rest of the household.
That's probably going to be the best thing to do. We know pets can get COVID. How much of it gets transmitted from them is not known, and how sick the animal can get isn't known. So as many people have pets that are part of their families and not just animals in their home, that they want to be careful with that. So wearing a mask in the household, just like anywhere else, does help protect both people from transmission. I think if somebody is kind of sequestered in their bedroom, it isn't really necessary for everybody else to wear a mask when they're not in their presence. So I think that's one thing to keep in mind. We don't want to suggest that things that are really, really hard to do are absolutely necessary.
And of course, the best practice is, of course, to do all the things that we can to prevent bringing COVID-19 into our homes. Do you have a few tips on prevention as we head towards the cooler months?
Well, everybody needs to keep in mind wearing a mask when they're out and distancing, and if we try to encourage everyone that if they're sick with anything, if they have any kind of symptoms, that they should stay home and not put themselves in a position of communicating that to others, and that will certainly help. If you are having gatherings of the family, if it's the same household family, it's perfectly fine to have a dinner in the house as long as everybody's either negative or positive, nobody's showing any symptoms of anything. It gets a little bit trickier when you interact with other people, go to their homes or they come to yours. That adds an element of risk. So smaller is better for this particular holiday season.
Absolutely. Of course, it's better to have one safe holiday to have several more in the future than to risk it all for once. All right, Connie, thanks so much for joining us. Again, there are some free testing courtesy of the health department available at Alstom. Of course, they will be closed on Thanksgiving and the Friday after, but reopening on Saturday.